We are pleased to have you with us today, Colonel Sridharan. Colonel is a career Army officer who served in the Indian Army for 30 years. He ventured into creating retirement communities in 2004, setting benchmarks for service and care with passion and compassion. CovaiCare is a pioneer in several areas of senior living and care, including assisted living, memory care, and palliative care. Well, thank you for agreeing to be with us, Colonel Sridharan, today.
Thank you.
And now, as we all know, the elderly are the most vulnerable demographic in the coronavirus pandemic. Pneumonia and various other comorbidities is what makes it serious for elder persons, as their immune system has weakened with age. What are the steps that CovaiCare has adopted in its communities in Coimbatore, Bangalore, and Puducherry to protect the health of their senior residents? Over to you, Colonel.
Thank you, Monmita. Firstly, it is not Puducherry, but it is Mysuru. But it doesn't matter. When we got to know about this coronavirus pandemic, or before it was declared a pandemic, we took certain precautions on a simple philosophy that we will keep the virus away from our retirement communities and we'll take all measures that we need to take. On that philosophy, we worked and evolved the various instructions to my team, to my elders, to everyone who comes in or goes out. And slowly we have been following that and updating it. And today it has become almost second nature for all of us to make it happen. And we are also supervising and ensuring that this is also managed by my vice president and others.
So you have everybody daily looking at it.
Basically what we have done is that we got a documentation done, which we follow it like a Bible. And as we learn, we are slowly updating it. And today we issued the first addendum to the Bible or the instructions that we have. So that we all follow that. My residents help me to ensure that we follow it.
And what are the size of the communities that you have? How many residents do you have in each?
It varies from 130 dwellings in one, 170 dwellings in the other, 70 dwellings in Mysuru. So normally you talk about 1.5 as per house. We almost have about 600 people living in these three dwellings, in these three communities.
So that's a big responsibility, particularly given the impact on the particular demographic that you're looking after on the, the retirement communities.
Yes, because I also belong to the same demography. I'm 71. So if I can protect myself and my wife also, I can protect her. Definitely my team can protect everybody else. Yeah. But having said that, I think this COVID-19 has stopped asking us for our birthdays. I believe a lot of young people also are getting affected by this virus. But notwithstanding that, I think, yes, we need to protect ourselves and we will protect.
Okay, thank you. Can you tell us a little bit about the 2CT facility in telemedicine that you have at CovaiCare facility and how this technology is helping you, particularly at this time?
I think this is helping us. Basically, we came out with it because we have a polycare center in Coimbatore, and where we have GPs and specialists on call, and the dentist and the physiotherapist. So we already hooked on to all our retirement communities through a telemedicine facility through Google. And this has come as a boon to us today because not only can my residents who want to consult a doctor at any time, they can call either through their resident health manager, or now we are even giving them a small instructions as to how they can call for these doctors to Google Duo. So it is they can do it from the house itself, from the apartments, through their mobile phones. Otherwise, they have to come to the medical center, or my resident manager helps them and goes to their place, and so that they can consult any doctor that we have on board, so that they don't have to go to any hospital with any any signs that anybody gets. Somebody gets a fever, somebody gets a cough, somebody gets a sore throat. But all of them are not COVID-19. To the hospital, we don't want them to travel to the hospital just because somebody has got any of this symptoms. So at least the first level, the doctor can come on screen and look at you. The nurse is there next door and she checks on you. And then we say that, okay, this is a normal case.
This is excellent. And, you're actually integrating technology into your facility to, in this case, and it's really come as, like you said, as a blessing at this time, when one of the main things is isolation and social distancing. So instead of rushing off to hospital, they can actually, get benefits from the telemedicine facility. So that's really.
I think I wouldn't call it as a blessing. I think we are telling anybody who wants to use this, please use it and call our doctors if they are available, and we can give the basic consultancy. Of course, parameters my doctors needs. We have the entire history of all my residents in my respective doctor's laptop, so there's no problem for them to know exactly what patient, what is his history, so that it becomes easy for them to diagnose.
Okay, one of the key factors, Colonel, in times such as this is to keep family members regularly informed and updated, almost on a daily basis. So how are you communicating with family members and assisting the residents also to be more actively in touch with families, because people are concerned and, you just need to know what's happening with your parents or your loved ones?
We have ensured that every resident of ours is at least can use the WhatsApp, except those countries which does not permit WhatsApp, then it go to FaceTime or some other, got Skype, and we see to it that they contact their near and dear who are living far away. They can meet them from the house only and speak to them. That is one that we do. Any of the children, they have any queries, they can ask us at any point of time, and we immediately answer them. And we have not had anybody going to a hospital so far, so we are, generally speaking, they are happy. We also spread the message on the digital media for them to see the various active actions that we are taking, so that they know that their parents are in a safe environment and they are following and they're enjoying the life in that community itself. They are not absolutely, lockdown condition. Their physical separation, we tell them to maintain 3 feet, but they can go for a walk, they can sit down and chit chat in that group within the community. Don't go outside. You want anything, that we are there to help you. And the children can also get to see all this in the media and social media. And the parents also tell them the instruction that we are given. Those, I think, has been passed on to the children also. So they know that every small issue that we can attend to at this point of time, they're quite happy with what we are doing.
That's excellent, Colonel, particularly because it's so important in these times to not be alone at some point, to know that there is a community supporting you. So that's really super. Thank you for being with us today, and we will be back with more questions in a bit. But thank you very much for your time.
And let us find an answer to this COVID-19. I think that'll be the best question or best answer you can give us. Thank you.
Yeah. Thank you. Thank you, Colonel. Bye-bye.
Bye-bye.